Good morning, everybody. My name is Stephanie Wine, and I'm the Clean Water Advocate for Penn Environment, a statewide citizens-based environmental advocacy group. We're here this morning to address the threat of lead in school drinking water and to introduce new legislation addressing that crisis. Speaking today will be Representative Karen Boback, Representative Austin Davis, Representative Mark Gillen, as well as Dr. Kelly Coons, Chair of the Nursing Department at Millersville University and part of the Alliance of Nurses for Healthy Environments, as well as Darlene Harris from the Pennsylvania Teachers Association and a member of the National Board of the PTA. Thank you all for joining us, and we'll get started.
Thank you, Stephanie. Good morning. Thank you all for coming today. Visualize this. When we open up a faucet and fill a glass, we do almost mindlessly, in that we expect what comes out to be clean water, and almost always it is. But almost always now means something different to the people of Flint, Michigan. And when the survey from the years 2012 through 2015 found that Pennsylvania had the highest number of schools with elevated levels of lead in their drinking water, it should have meant something different to all of us as well. It certainly did to me. Today we are going to get the latest numbers from our friends at Penn Environment. So without stealing too much of their thunder, let's just say that we need House Bill 930. My legislation would require public schools and non-public schools to annually test all outlets used for cooking and drinking, test the outlets for lead, and to ensure that the water is safe to consume. I'm pleased that the situation was acknowledged last year at the end of session. However, legislative action did not go far enough. Clean water is not a Republican or Democrat issue. It is a constitutional issue. Article 27 of the Pennsylvania Constitution states, "The people have a right to clean air, pure water, and to the preservation of the natural, scenic, historic, and aesthetic values of this Commonwealth." House Bill 930 currently has 39 sponsors with plenty of bipartisan support. As a mother, as a grandmother, as a former teacher, I advocate for this bill with every ounce of passion that I have, and I'm hoping that this media event will help catapult us to the next level, mandating annual testing of water in our schools. At this time, I'd like to introduce one of my co-sponsors, freshman Democrat Austin Davis from Allegheny County. Austin?
Well, thank you, Representative Boback, and thank you for sponsoring this very important piece of legislation. I'm proud to be here with you today as a resident of the city of McKeesport and the state representative for the Mon Valley. I'm fully aware of the health crisis taking place in Allegheny County and across the Commonwealth when it comes to lead contamination. This is a matter that can't be taken lightly. In my neighborhood, lead contamination is a serious problem for adults and children alike. When we send our children to school, they go there to learn. The last thing they should have to worry about is their drinking water. Students spend roughly 8 hours a day, 5 days a week, in schools where their only source of drinking water is that which is provided by the district. Unfortunately, a recent report from Penn Environment gave the Commonwealth an F regarding the amount of lead in school drinking water, which means our children are exposed to hazardous substances each and every day. This is unacceptable and is an issue the state legislature needs to address immediately. Regardless of our political affiliation, it is imperative that we come together to do what is in the best interest of this state, its residents, and especially its children. That said, there are legislators in the House on both sides of the aisle who are willing to put their political differences aside and work together to protect the Commonwealth's children. Most recently, House Bill 2025 was reintroduced in the House. This bipartisan bill would require the public and non-public schools to test their water yearly to ensure safe drinking water. I supported this bill last session, and I'm supporting it again because I've seen firsthand the repercussions of having high levels of lead in a community. This has to stop, which is why I'm asking House Democrats and Republicans alike to come together and support this bill so that we can enact change and provide a healthier future for all our children and generations to come. And with that said, I'd like to introduce another colleague of mine, Representative Mark Gillen, who's been a champion on this issue. Mark?
Well, thank you very much, and I greatly appreciate the initiative that my colleagues have taken here, especially Representative Boback. I'm going to approach this maybe slightly different than my colleagues' excellent prepared remarks. A couple hours ago, I left our family farm in Berks County in Robinson Township. I had the opportunity, because I saw a bird of prey that I wasn't as familiar with as I would have liked to have been, hovering over the pond, and I walked down there, and I walked by one of the 7 springs that are on our farm, and I would like to think that the water that's leaving our watershed-oriented property is pristine. We do everything we can to make sure it's clean as it heads downstream. And I'd like to think that the end user of that water is getting something that is contaminant-free. And indeed, we have a responsibility being on a family farm in a watershed area to make sure that that happens. But when I think of the end user, and we have a school building where there may be hundreds or a complex, even thousands of young people, that school doesn't have to test that water. We test the water on our family farm. We test what comes out of that well on our family farm, making sure there's no contaminants in it. And I think most of us in this room, whether you represent the press, you're a legislator, or you're part of our environmental movement in Pennsylvania, looks at it through the prism of family. I have 5 daughters. My daughters are 5, 11, 14, 16, and 19 years old. Yes, I have several teenage daughters, and I'm managing to survive in life. But what is a non-negotiable is clean drinking water. And currently, our public schools are not required to test. And the opt-out provision is they could discuss this issue, lead issues, in a school facility at a public meeting. How much assurance and comfort level does that provide for you? Your child is drinking water that has not been tested. Are you going to be placated by the fact that there was a discussion at a public meeting in a school facility? And in fact, now that you heard that discussion, you have every assurance of nothing, absolutely nothing, except a discussion took place. And so what we are going to do is put into law really what should have been in place already. And so not only is this legislation current and needs to get passed, this legislation is long overdue. And a number of our colleagues have addressed this issue and was well articulated. You know, drinking water and clean air, if there's anything that ever should and ought to be bipartisan, it's this issue. I'll let you in on a little secret just between us here, okay? I'm a Republican out in the suburbs in a rural area, and my mother, who's a Democrat, lives in South Philadelphia. And there's one thing that we agree on: clean drinking water. Thank you.
Thank you, representatives, for those words. Again, my name is Stephanie Wine, and I'm the Clean Water Advocate at Penn Environment, the statewide citizens environmental group. We are releasing today the report that's been mentioned, Get the Lead Out, which compares Pennsylvania's performance to 32 other states in addressing the crisis of lead in our drinking water and finds that we come up short. We're also here to call for solutions to this pervasive and preventable threat to children's health. The grades are in, Pennsylvania is still failing to keep children safe from lead in their drinking water. Since we first released this study in 2017, more and more communities across our Commonwealth have discovered that lead threatens school drinking water. The very places where our children are going to learn and to grow, they could be drinking water containing potent neurotoxins that harm their ability to develop, that can cause cognitive difficulties and learning disabilities that will last with them their whole lives. And this is happening in every corner of the Commonwealth, from Pittsburgh to Philadelphia, from Erie to Lancaster. It's happening in rural and suburban and urban schools. Rural schools like Summit in Butler County, where lead levels were high enough that acute lead poisoning sent kids to urgent care, and they went undisclosed to the community for months. Places like Ephrata in Lancaster County, where a school had lead levels that included readings over 1,000 times higher than the maximum level we're proposing of 5 parts per billion. And urban schools like Pittsburgh and Philadelphia have a problem that is well documented as it is pervasive. And yet we continue to fail our students. Most parents that I talk to, they are shocked that most schools aren't compelled to test their drinking water for lead. And when schools do voluntarily test, acting in good faith for their students, best practices aren't always utilized because there aren't clear guidelines. Acceptable levels of lead are often far too high, and the results aren't necessarily shared with the parents or the teachers or members of the community. And so in the 2 years since we last stood here, releasing this report, Pennsylvania has not stepped up sufficiently to close these gaps and to fill that void. So there's a clear threat, and our study shows that Pennsylvania's laws don't prevent children's drinking water from being laced with lead. As some of the representatives have already referenced, current law says that schools can avoid testing simply by talking about this at a public meeting. It doesn't require remediation when lead levels are found in excess of the action level being used. The action level being used, 15 parts per billion, is a standard rejected by the American Association of Pediatrics as far too high to protect health, and it doesn't require testing to be shared directly with parents or with the school community. And so without standardization, when schools do voluntarily test, even they aren't necessarily sharing this information or doing it in the best way. The Commonwealth has to give them the support and the guidelines that they need. We need to test, treat, and tell when it comes to lead. And the good news is House Bill 1930 would do all those things. One, it would establish annual testing for all water outlets in Pennsylvania schools used for cooking or for drinking, and it would make sure that best practices are used when doing that testing. Two, it would make mandatory disclosure to all parents and members of the school community who have the right to know if their children are safe. And three, it would establish a statewide standard for the acceptable level of lead at 5 parts per billion, making Pennsylvania a national leader in addressing this from a health-based perspective. Last year, this measure enjoyed bipartisan support. In the 2017 to 2018 session, there were over 70 co-sponsors. Very bipartisan. Parents, health experts, and educators are especially eager to see this bill move. And so I will turn it over to some people who will speak to that need. I'd like to introduce Dr. Kelly Coons. She's the chair of the nursing department at Millersville University and also a member of the Alliance of Nurses for Healthy Environments. Dr. Coons.
Good morning. As Stephanie said, my name's Kelly Coons, and I am a registered nurse, as well as a member of the Alliance of Nurses for Healthy Environments, as well as an educator. And as a nurse, as an educator, and as a parent, I'm appalled by the F grade our Commonwealth continues to receive in addressing lead in our drinking waters in our schools. 2 years ago, when the first report came out from Environment Pennsylvania, I spoke at the same press conference, and I brought my then 11-year-old along with me. And he was thrilled to be part of that because I wanted him to see the importance of advocacy and impact on the citizens of our Commonwealth. Now, 2 years later, he's 13, and when I told him last night that we had received another F, he said, well, you certainly wouldn't let me get away with that. So I need for the Commonwealth to show our children that we do care and we want to make this better for them. I stand here today and I'm heartened to know that our elected officials on both sides of the aisle are taking notice and are ready to seriously address this issue. The Alliance of Nurses for Healthy Environment strongly supports Representatives Karen Boback, Austin Davis, and Gillen, along with many of their peers in this bipartisan bill being reintroduced to address this important public health issue. So as a nurse, my concern is about the cognitive and behavioral and long-term effects that lead has on our children. We know that lead toxicity in children has decreased significantly since the U.S. banned leaded gasoline in the 1970s. But we still have a very long way to go in preventing childhood exposure to this toxic chemical. There aren't any safe levels of lead exposure. And as a parent, I can tell you that the most common question that you receive at the pediatrician's office is, how old is your house and have you repainted it? Because we're worried about lead in our paint. We don't think about lead coming out of the faucets in our children's schools. Cognitive and behavioral effects can occur at blood levels below 5 micrograms per deciliter. And that's a very low level of lead in a child's bloodstream. And it's estimated, and this is staggering, that lead toxicity accounts for an estimated total loss of 23 million IQ points among our US children. What's even more staggering is that approximately 20 million of those lost IQ points occur in children with lead levels less than 5 micrograms per deciliter in their blood. We simply can't ignore the issue. Our children deserve better. The cognitive and behavioral effects of lead exposure come at a huge loss to society and places the affected children on a trajectory in which reaching their full potential becomes a near impossibility. It's estimated that childhood lead exposure costs the U.S. over $50 billion annually. If we simply prevent lead exposure, we can help our children get their best start in life. When we address sources of lead exposure, such as lead in the school's drinking water, we see a significant financial impact. Cost savings through decreased healthcare costs, as well as increased productivity through the life of that child. All children in the Commonwealth should have access to safe, clean drinking water, especially in their schools, where they spend such a significant part of their day. So I personally, and on behalf of the Alliance of Nurses for Healthy Environments, thank Representative Boback for reintroducing this common sense piece of public health legislation. Addressing lead in our schools' drinking water through this bill is an essential first step in bringing our grade up to an A, and it's a vital investment in the health and future of our children. Thank you.
And finally, Darlene Harris, a member of the National Board of Directors of the PTA, the Parent Teacher Association, and a member of the Pennsylvania PTA, will say a few words.
Good morning. My name is Darlene Harris, and I am both a member of the National Parent Teacher Association Board of Directors and the Pennsylvania State Board of Managers. Clean water is essential to the health of children. Children drink more fluids per pound of body weight than adults, and their bodies are more susceptible to contaminants like lead. The plumbing found in some older buildings and water systems may contribute to lead pollution in our drinking water. Even though our progress has been made by federal and state governments to reduce water pollution through the Clean Water Act of 1972 and the Safe Drinking Water Act of 1974, there are still many reasons to be concerned, especially since these laws don't actually require monitoring the quality of the tap water within our schools. Together, the Pennsylvania PTA and National PTA, in recognition of the importance of clean water to the health of children, support the following: careful preservation and protection not only of water supplies, but monitoring the quality of the water coming out of the tap. Strong, strict water quality that help assure a healthy environment for children. Local, state, and federal legislation and regulations to maintain the highest possible levels of water quality, like the measure being discussed here. Effective implementation of local, state, and federal water quality standards. It's not enough to have strong laws, we need to enforce them. Cities, counties, and states should have higher water quality standards than the federal standards where appropriate. And finally, right-to-know legislation and regulations in order for the public to be more aware of the environmental health hazards in their community. When we test water quality, we have to tell parents they have a right to know that their children's water is safe. When we send our children to school, we expect the healthiest of environments and not to have sick children coming home. It's time to stop kicking the can down the road.
And now, Representative Boback will now wrap this up, and then if you have any questions, you'll be free to ask them. Thank you.
So what can you do? You can do a great deal. Encourage your legislator to support this bill without amendment. We have the ability now, with your help, to go from an F to the honor roll. Please, it's up to you, it's up to us. Let's get the lead out. Thank you for your attention.
All right. Any questions from anybody here? Yeah.
Require any remediation efforts, or is it solely just testing by schools?
So the question was, does the bill require remediation efforts? House Bill 930, if lead levels are found in excess of 5 parts per billion, the lead level would then need to be lowered below 5 parts per billion. And that can be done in a couple ways. You could actually take out all the lead infrastructure. Some districts are choosing to make that investment. That can be a bit of a pricey proposition. So what more school districts are doing, those that are already trying this, is to install lead certified filters. Those work well, and with constant upkeep and monitoring, it is a really great way to make sure that the lead stays out of the water without breaking the school budget's bank.
Cost on those filters?
It does vary, but the School District of Philadelphia, which is already doing this, is finding the filters cost about $1,500 for the drinking water, the drinking fountain, in their experience, about 10% of the outlets in the district were actually needing them. So it's not all of them because the lead fixtures aren't everywhere. And that's in a district with very old buildings. But the filters have been working well for them. And that's obviously a large school district with a famously tight budget. So if they are making this work, we contend that that's something that all of our schools can do.
And are there other states that have this requirement?
Yeah, and I can refer you to the report for specifics. There are many states well ahead of us, let me actually, no, it's not, yes. So making sure I get things right. So Washington, D.C. is leading the pack. They have a 1 part per billion standard. They have regular testing, but Illinois, California, New York, Oregon, Arizona, so states all over the country of all different sizes and political leanings are ahead of us in terms of their statewide efforts to close that lack of federal oversight and make sure that our schools are safe in terms of the water quality.
If this legislation passed, how long will schools have to get up to standard?
Representative, do you know that off the top of your head?
I think it's 30 days, but we'll get back to you.
Yeah, it's not. I think it's a little longer. Let me check the actual wording and get back to you with that. But one thing that is important is if lead is found above that 5 part per billion, within 24 hours, that outlet needs to be shut off, and then the school, so to remove the threat right away, but then the school can put together a plan for how they're going to address the levels that are found.
Disclose that to parents as well as
Yes,
media?
within 2 weeks, parents would need to be notified. Post it on their website, send a note home. The school has a lot of methods of communication. We want them to be used for something that's this important. Anything else?
Provide any additional funding, right, for schools?
It doesn't have a funding mechanism inherently built in. There are different pots of money that could be used at the to provide that funding. For example, PennVest funding and the state drinking water revolving fund. But the school districts that are doing this out of their maintenance budgets and finding that it is very doable. We just think that when you're maintaining the schools, you have to choose the thing that literally could be causing kids brain damage. That's what you got to fix first. So that's what school districts like Philadelphia that are already taking action are doing. And so that's there isn't one inherently baked into the bill as it stands right now. Anything else? I guess that's some good ones. All right, well, thank you so much for coming. If anyone doesn't have copies of the release or the executive summary, please see me.